A new baby is the beginning of all things. Wonder, hope, and dream of possibilities. Good afternoon, honorable dignitaries. My topic of presentation is complication of antenatal care. My objectives are to summarize the complications in antenatal care. In the maternity cycle, the antenatal period starts from the zygote stage to the birth of the child. And during this stage, the fetus draws all its nutrition from the mother. So we have to consider the mother and the fetus as a single unit, because a healthy mother will lead to a healthy fetus. Antenatal care refers to all the services and the care received by the mother right from the confirmation of pregnancy till the birth of the child. Now, in the beautiful journey of a mother, not everyone is so fortunate. There are a lot of twists that are seen in the maternal saga. These unseen situations are a result of medical, obstetric, or nutritional or lifestyle, or maybe a combination of them. First is the medical complication. Number one is the gestational diabetes. It is a condition where there is elevated blood glucose level, and it is mainly seen during the pregnancy and it resolves after that. But so it has to be separated from the pre-existing diabetic conditions. Second is hypertension. Gestational hypertension mainly arises in the 20th week of pregnancy, and it is characterized by a systolic blood pressure of 140 mm of mercury or more and a diastolic blood pressure of 90 mm mercury or more. Then we have autoimmune disorders. Various mothers are well prone to autoimmune conditions like systemic lupus erythematosus reactive or rheumatoid arthritis, and the various immunological and hormonal changes during pregnancy can flare up these conditions. In infections, we have hepatitis B or syphilis, herpes. All these are sexually transmitted disease and needs to be properly screened and treated. The impact on maternal health include preeclampsia, medical conditions like seizures, organ damage, and this can lead to dire consequences for the fetus like neonatal hyperglycemia, macrosomia, respiratory distress in the fetus, congenital heart block, fetal growth restriction, etc. Here is a picture showing jumbo-sized baby in comparison to an average newborn. This is called macrosomia, and below it we can see microsomia, that is mini babies. Here in the picture we are seeing the children defects that are born to people with, mothers having gestational diabetes. First is the cleft lip and palate, second is the omphalocele, then we have the limb defects, and thirdly we have the congenital heart defects like defective vessels, leaky valves, and portal heart. One of the primary reasons could be the high glucose level leading to excessive oxidative stress in the fetus, leading to all these conditions. Here we can see an infant suffering from chlamydia trachomatis and followed by congenital herpes. These are all acquired by the infant during birth from their mother, during childbirth, who were infected with these. Now one term that I have used is preeclampsia. We have to separate preeclampsia from the gestational hypertension. In preeclampsia, we can see that there is end organ damage, that is damage to kidney, brain, or heart. And as a result, there will be presence of protein in the urine. All the possible signs of preeclampsia are shown in the figure. This is a very serious condition and needs to be treated properly. Then we have second kind of complication, that is obstetric complication. And the first one is placental abnormalities. The complications that include first is the placenta accreta, placenta increta, and placenta procreta. In accreta, the placenta is deeply attached to the uterine wall. In increta, it attaches to the uterine muscle of the myometrium. And in percreta, it completely pervades the uterine muscle and the uterus itself and attaches to other tissues like bladder. On the left side, we have a normal placental attachment. Then we have placenta previa. Here, the placenta attaches to lower segments of the uterus. As a result, there is partial or complete occlusion of the cervical opening, and it can lead to obstetric complication during birth. Then we have vasa previa and filamentous cord incision. In vasa previa, typically seen in bilobe placenta, the fetal body of the head will compress the placental vessels, leading to hypoxia or fetal starvation. In filamentous cord insertion, the umbilical cord, instead of inserting into the placenta, will insert into the placental membranes. And all these conditions will lead to increased risk of hemorrhage during childbirth and can be potentially fatal for the mother. And the second is preterm labor. In preterm labor, there is birth of the fetus before 37th week of gestation. Full term is 40th week. It can lead to the primary concern is the immaturity of the lung development. As a result, there can be increased fetal death. Then we have multiple pregnancies. Multiple pregnancy can also pose obstetric complication, and one factor is the nutritional deficiency, because the mother may not take adequate nutrition to maintain so many babies. Then finally we have lifestyle and nutrition. First is the smoking. It can lead to preterm birth, lack of nutrition, low birth weight, and then substance abuse. First is alcohol and drugs. When we talk about alcohol, the primary thing that comes to our mind is fetal alcohol syndrome. Here is the typical picture showing the typical symptoms of fetal alcohol syndrome. Then we have poor nutrition, that is folic acid deficiency or iron deficiency, along with iron deficiency can lead to neural tube defects, as shown in this figure. Very common is open spina bifida and neural deficiencies. Then all these poor nutrition can also affect the mother, like anemia, overweight, poor immunity, and gestational diabetes, coupled with stress, low physical activity, vitamin D deficiency can all exacerbate these conditions. These are the risk factors for complications. And my recommendations include early regular prenatal visits, screening, awareness, psychological support for the pregnant mother, postpartum follow-up, continuous research and training. Thank you.